Welcome to our channel UK Visa and Immigration Updates. Today we will talk about the new changes to immigration laws that have been made by the UK government. New rules to radically cut net migration and tackle visa abuse are now in force as part of the government's plan to bring down unsustainable levels of legal migration. Care workers will now be restricted from bringing dependents, after a disproportionate 120,000 dependents accompanied 100,000 workers on the route last year. Care providers in England acting as sponsors for migrants will also be required to register with the Care Quality Commission, the industry regulator for health and social care, in order to crack down on worker exploitation and abuse within the sector. It forms part of a wider package of measures, which is being implemented as soon as possible, which means a total of 300,000 people who were eligible to come to the UK last year would now not be able to do so. Home Secretary James Cleverly said, "Care workers make an incredible contribution to our society, taking care of our loved ones in times of need. But we cannot justify inaction in the face of clear abuse, manipulation of our immigration system, and unsustainable migration numbers. It is neither right nor fair to allow this unacceptable situation to continue. We promise the British people action, and we will not rest until we have delivered on our commitment to bring numbers down substantially. Our plan is robust but fair, protecting British workers, while ensuring the very best international talent can work and study here, to add value to our society, and grow the economy. There is clear evidence that care workers have been offered visas under false pretenses, travelling thousands of miles for jobs that simply don't exist, or to be paid far below the minimum wage required for their work, exploiting them while undercutting British workers." Minister for Social Care, Helen Whately, said, "International care workers make an invaluable contribution caring for our loved ones, but international recruitment and more immigration are not long-term solutions to our social care needs. These rules provide a more ethical and sustainable approach. We are boosting our homegrown workforce by reforming social care careers. These include the first ever national career path for care workers and a new care qualification. Our reforms will grow the domestic workforce and build on our success over the last year that saw more people working in social care, fewer vacancies, and lower staff turnover." The government has been clear that roles should only be included where they are skilled and in shortage, and that no sector should be permanently reliant on immigration. Inclusion on the list must not serve to reduce pay and undermine the recruitment of British workers. From the 4th of April, the minimum salary required for those arriving on the skilled worker visa will increase from £26,200 to £38,700. This will further drive down numbers, reduce pressure on public services, and prevent the undercutting of British workers by employers who look to recruit cheap labour from overseas. The government's robust approach will prioritise the most talented and highly skilled people from abroad who will add value and contribute significantly to growth of the economy, whilst encouraging employers to invest in training, upskilling, and recruiting domestic workers. The government has been clear that immigration is not the long-term answer to social care needs, and care providers should hire more British workers. The Department for Health and Social Care is leading a programme of work to grow and support the domestic social care workforce. This includes better training, clearer career paths, and improved job prospects through a new accredited qualification. Please subscribe to our channel and hit the bell button to get timely notification of upcoming videos. Thanks for watching. Goodbye.